Hi everyone, it's Nishti here, specialist dietitian for children and parents, and in this video I want to talk to you about the 4 steps to how to manage a baby with reflux. Now if you're a parent and your baby is really unsettled and you have tried it all and you're thinking, what is going on? Why is my baby still struggling? Why are they still perhaps refluxing? Then this video is for you. Make sure you watch it to the end and make sure you comment below and let me know which step that you really needed to hear today. So let's dive into the video, the 4 steps to how to manage a baby with reflux. So for step number 1, the dietitian will perform a really detailed history to what is going on and differentiate between reflux and gastroesophageal reflux disease. This is when reflux becomes very uncomfortable for the baby and for the family as a whole. Baby is unsettled, feeding has become difficult, baby might be losing weight now and really struggling to feed. That's when alarm bells go off and we think, right, this is not just simple reflux and regurgitation, this is gastroesophageal reflux disease, GORD. Now, in 40% of cases, now this is based on research, that in 40% of cases of GORD, gastroesophageal reflux disease, it actually turns out to be an allergy to cow's milk. So what the dietitian will do, or what we will do, is we will look for other signs and symptoms that could suggest that. So for example, atopic dermatitis, eczema, rash, congestion, wheeze, blood in the poo, anything like this could suggest an allergy to cow's milk. If that's the case, then the dietitian will skip step number 2 and 3 because there's no point, and we will go straight to step number 4. So it's very important, particularly preterm babies really struggle with gastroesophageal reflux disease and cow's milk protein allergy. So we always have to really be careful in that first assessment to try and differentiate what is actually going on. It's not just putting children on medication. We need to do a thorough assessment to really try and identify what is the problem. Now, if we don't suspect there is an allergy or if we are unsure, we go to step number 2. So step number 2 is a proper feeding assessment, and we usually get the health visitor involved. Whether you're breastfeeding or formula feeding, there's so many things to consider. Positioning, volume of feed, frequency of feeding. Do we need to feed little and often? If your baby isn't feeding in the night, which some babies don't, do we need to do that to try and reduce the volume during the day? Would that help with their reflux? So there are so many things to consider. When you're burping your baby, do you have to burp them a bit more often perhaps? Or when you're burping them, are you holding them still and not jumping up and down, which I'm sure you're not? Those are the little things, but they can actually make a tremendous difference. So we always make sure that in step number 2 that we do a thorough feeding assessment and we get the health visitor involved for that. Now, step number 3, that's when we will think and look at whether we need to try a thickener. A thickener, whether your baby is formula fed or whether your baby is breastfed. For breastfed babies, there is something called Carabel, which we add to express breast milk to make it a bit thicker, which could help as well with the reflux. If your baby is on a formula, you may want to consider an anti-reflux formula. Now, one important thing is they all have different thickeners used. Okay, now some children can tolerate one thickener over the other. If you read my blog below this video, you will see a table of thickeners used in formulas, but also for breastfeeding babies. A table, you will see the thickeners there, and it is worth trying a different anti-reflux formula if one hasn't worked, because perhaps your baby didn't tolerate that thickener. I hope that makes sense. There is no research to show that one thickener is better than the other. But it's always worth trying. I've seen children get really unwell on one thickener, but on another they are doing fine. So every child is different. So step number 2 is feeding history. Step number 3 is looking at the thickener, which brings me now, if none of this has worked, then it's time to think now about step number 4. Number 4, that's when we eliminate dairy from the diet. If you're breastfeeding your baby, we will ask mother to go dairy-free and soya-free. The reason for that is that because soya also tends to be a big problem in children with suspected cow's milk protein allergy. Work with a dietitian. Eliminating food groups can result in nutritional deficiency, so make sure you work with a dietitian. It will really, really benefit you and your baby. So when we do elimination diets with parents, we do it very carefully, and we don't just look at the dairy, we look at the overall diet, making sure they have enough iodine, making sure they have enough omega-3 ALA, or making sure they have everything that we need to maintain healthy health and well-being, both for the mother and for the baby. If you're formula feeding your baby, that's when the dietitian, we prescribe specialized formulas, and we actually deliver these formulas to your door within 3 working days. These formulas are only on prescription, and both your dietitian and your doctor can prescribe these, and they are either extensively hydrolyzed formulas or amino acid formulas. So they have been made in such a way where the protein from the cow has been broken down or completely taken out of the milk to make it easier for baby to digest. Now, your doctor and your dietitian can prescribe these. So what we will do, if we suspect, if your baby has atopic dermatitis, eczema, rash, we go straight to an amino acid formula. They are completely free from cow's milk, and they are completely fine. They still have all the nutrients and calories that baby needs, but they don't have any cow's milk. And we will try that for about 2 to 4 weeks. And sometimes we may even need a thickener with that, which would be caramel, and that usually would do the trick. But sometimes we don't even need to add a thickener, because all along it perhaps was cow's milk protein allergy. And that's the whole point of working with a dietitian or a doctor, is not to put your child directly onto medication. It is to really go through this step-by-step guide that we have talked you through today, because by eliminating dairy from the diet, you can really tell whether it actually is reflux or whether it was an allergy to cow's milk. And from my personal experience working with children for so long, most often it was cow's milk protein allergy. Baby was just put on medication, but actually no one bothered to do this step-by-step guide. And that's because it takes time and effort. But why use medication if we don't need to? Medication is so helpful, but only when it's really needed. And we often find that children have been put on medication, but actually they didn't need it. And then when we go on to a dairy-free diet, whether that's through formula or mother stops dairy in her own diet, symptoms get better, and then we try and wean them off medication if they had been put on medication. So the elimination diet is so helpful to try and identify whether it is cow's milk protein allergy or not. So I hope that was helpful for you. If it was, please comment below, let me know what you think. And if you have any questions, please feel free to reach out. We provide immediate help and support to families all over the world with suspected cow's milk protein allergy. If you think your baby has reflux, perhaps also think, could it be an allergy to cow's milk? I'll see you all in the next video.